years old?
Yes, doctor.
Nice to meet you, Mr.
Nice to meet you, doctor.
I understand you have been complaining of hand pain. Can you tell me more about that?
Yes, doctor. I'm suffering this hand pain actually since 2 years. Okay, but recently it started to affect my life. I can't do my work. I'm drawing in the university. I'm an engineer, and now the pain increases, and all the time I'm suffering from it.
I'm so sorry to hear about that. Is it in both hands or one hand only?
Yeah, it is in both hands, doctor.
And it starts 2 years and it's kept increasing over time.
Yes, doctor. It's increasing. Recently, it become like persistent.
Okay. Is it more in the morning or all over the day it is present?
It's all over the day, doctor.
Anything relieves it? Anything makes it better?
Nothing specific, doctor.
Nothing specific. Anything make it worse?
I think no, it's there. It's there all the time, doctor. Maybe while I'm doing any stuff, it hurts.
Okay. Any laxity of the joints of your hands?
Laxity, yes, doctor. I have laxity in my hands.
You have laxity
I know since I was young that I can do with my fingers the funny things that my colleagues can't do it.
Okay, like you can stretch your finger back.
Yeah,
Can you show me?
Exactly.
Can you show me, please? Okay.
Yes. So the patient can extend her index and touch the forearm. Okay, and the patient has really have laxity.
Okay, can she put 2 fingers around her wrist?
Around her wrist, no.
Okay. What about the span of her arms?
No.
Span is no. Okay. Any color changes in your hands?
No, doctor.
No color changes. Any electrical light pain in your hand?
No, doctor.
Any other joint affected?
Yes, doctor. Most of my joints are.
Most of your joints are lax and painful also?
Lax with pain, yeah.
Lax with pain. Okay. Any rashes?
Rashes, not really, doctor, but whenever I have any wound, it looks weird. The healing of these ones looks weird. Any trauma, it looks weird when it starts to heal. I have a skin that make me look like an old girl. I'm 22, doctor.
Okay, can I see the patient face?
Is it the knees?
I also understand that you have been complaining of heart racing.
Yes.
Okay. Is it regular or irregular?
It is regular, doctor, but I started to feel this awareness heartbeat with some shortness of breath recently. I don't know if it's anxiety of that or it is something serious.
Okay. Any chest pain?
Chest pain, no.
No chest pain, no cough. Any cough?
Cough, no.
Any dizziness, any loss of conscious?
No.
Can I see the patient mouth and the hands?
What do you want to see?
The patient mouth oral cavity.
Mouth, yeah, nothing abnormal.
What about her hands?
The hands, there is hyperlaxity and there is some pain when moving the fingers.
Okay. Can I see her eyes?
Her eyes, nothing abnormal with his eyes. No need to examine.
Okay, so no redness, no pain in your eye.
Yes, no redness, no pain.
No blurring of vision.
No blurring of vision.
Can you tell me how is this affecting your life?
Yes, doctor. As I told you, I'm an engineer and I'm used to pain and using my hands. Now I'm really suffering with that because the pain is very severe.
Okay, I'm so sorry about that.
Thank you, doctor.
So this is affecting your work. You cannot work like the same before.
Yes, doctor.
And the home also the same thing?
And what?
At home also it's affecting your daily living activities
Yes,
at home?
2 minutes remaining, doctor.
Yes, what is your concern?
I want to know what's going on, doctor. And there's something, doctor, also I'm suffering from. I also noticed that I have some blood coming with my back passage.
You have blood coming with your back passage?
Yes, doctor. So I'm worried about that also. I remember now that I want to tell you that.
Okay. Did you lose any weight with that?
No, doctor.
Do you have any blood coming from anywhere else?
No, doctor.
Any abdominal pain?
Abdominal pain? No, doctor, not really.
Okay, so I think you have any one of the family members has the same condition, dyslexia in your joints?
Yes, doctor. I have my sister. She had a history of recurrent dislocation of her shoulder. Like every 1 year, every 2 years, there is dislocation of the shoulder.
That you have been diagnosed with anything?
I'm not sure, doctor. They told her that she has a joints problem, but I don't know it. I'm not sure about it. She's not living with me.
Okay, so I think you have a condition affecting your collagen and your joints. I have differential diagnosis of something called Marfan Syndrome, and another thing called sodium elasticum. This is my top differential diagnosis. I have to run some investigation before we get to the bottom of this diagnosis. And also we have to run a multidisciplinary team, including the joint doctors, physiotherapist, occupational therapist, to reach a plan.
Time finished, doctor. Time finished. Thank you, Dr. Amr. So this is Dr. Amr done now. So we want the examiners to give him their opinion, this course. Give me a second. Don't write anything before I close the chat. The chat will be me only. Otherwise, Dr. Amr will know what you other numbers, and then there will be revenge.
No, there will be no revenge.
I mean, if everyone writes you, so there will be revenge. You give me 15, I'll give you 10.
No.
So we have Dr. Mishazia, Dr. Okay, who else? Give me more scores, more examiners, please. Dr. Adam, very tough. And Dr. Abdullah Dawal Noor is very kind. So you shouldn't be very tough and you shouldn't be very kind, okay? You know when someone gives you 28 and the other give you 8?
Yeah, it's a big difference.
Yeah, it's like somebody didn't come with that. Okay, so yes, the average they give you between 18 to 24, doctor. This is the average. Okay. So let me start asking you the question, then we'll proceed. So what's your differential diagnosis, doctor?
My differential diagnosis is pseudoxanthoma elasticum and Ehlers-Danlos syndrome.
What is the component of pseudoxanthoma elasticum in this case?
Actually, I'm not sure about this.
Okay, why do you think this patient has shortness of breath? Why there is shortness of breath?
Maybe she has a heart failure from aortic.
What could be the cause of the bleeding rectum?
I'm not sure.
Okay.
Hmm.
So how would you proceed?
So it will be a multidisciplinary team, including the rheumatology, occupational therapist, physiotherapist. This is a team. Investigation will include basic blood tests like CBC, ASR, CRB, liver and renal profiles, autoimmune profile.
Okay.
Also, we might consider a lower GIT score also for the bleeding coming from her back passage.
Okay. Okay, doctor. So, would you advise her anything about her awareness of heartbeat? Do you know if she's smoking? Do you know if
No, I did not ask about
it could be pseudoxanthoma elasticum? Do you know what the risk the patient in pseudoxanthoma elasticum have?
No, I didn't ask about
risk of what?
She has a great risk of ischemic heart disease.
This is the pseudoxanthoma, right?
Yes.
Okay, doctor. Thank you.
Okay.
Okay, thank you, Dr. Amr. Thank you very much. Okay, so let's go now through your performance. First of all, I don't want you to be down with the patient, with the examiner. So two things will be wrong while dealing with the examiner. If you are, you know what can we call it in English? Are fun, you know. So it's like you're just doing. Okay, so let's finish this hell and okay. So this is
not like that.
Yeah,
Okay.
yeah. No, I'm not talking about what you mean. I'm talking what I received. So
Yeah, sure.
I'm putting myself in the place of the examiner. So the examiner is a human, right? So he will feel that you're just trying, hey, let's finish this and go home. Okay. So
Yes.
as I told you, this is an interview. So you need to show me yourself. And if you didn't practice that, you'll not do it in the exam. It will be like, so sometimes you don't know the answer for the question, but you're still impressing the examiner, impressing them by your attitude, by the way you are speaking, by how active you look like, you know what I mean? So I want you, when you practice the case, to be like more active, like showing them how active you are, that you are, they like this type of doctor. They won't want, I know how active you are, but I mean, yes, I know you're tired and this is just practicing, but I want you to practice to be more active, to use it. And you were talking very slow, okay? You didn't even examine the patient's chest or heart. Patient with shortness of breath and palpitation. You didn't comment on checking his pulse. You didn't check his heart. You didn't listen to any murmurs, right? So it's about you. I want you to put more concentration and focus on the case. Besides that, I want to improve the confidence. Sometimes they will consider it like overconfidence, or sometimes they will consider it not lack of competence. Okay, so both of them won't have a good impact. I want you to be more active while practicing that and be fast. They are crazy to put 8 minutes to do all of that. That's why they're going to change it. But we have time restrictions, so we need to be fast. So ask all your questions very fast. Go there. So here you asked a very good question very early about elasticity, and the answer was yes. And the answer took you to the side of the algorithm on the right side. So you put Ehlers-Danlos and pseudoxanthoma and Marfan's, right?
Yes.
Then you become very disorganized. You start to ask, show me this, show me that. Then I don't know if you are examining, if you are asking, what's your plan of examination. So to correct that, what to do? You will check. You found, as we said, remember the colorful page. Do you remember the colorful page?
Yeah.
So you will go to the etiology. There is no specific, but there is family history. So you want to ask about the family history because this is a genetic disease. This is about the etiology. So yes, the kid, my sister have the same problem. So then I will put in your mind what is the Ehlers-Danlos and what is the pseudoxanthoma, so you know exactly what to ask and what to examine. And at this stage, you want to go and see what is to confirm your diagnosis. There is some other criteria. So what are the symptoms you know for Ehlers-Danlos? The first thing will be the skin problem, which is the fragility. The patient with Ehlers-Danlos they have fragility of the skin. That's why you will see the fish mouth scar. Whenever there is a wound, it will look like a burn of a cigarette, or we call it a fish mouth scar. Look at the patient's knee. Okay, it looks the wound looks weird, you know. So this is a fish mouth scar, especially in the knees. And there is also hyperextensible joints. So as the patient told you, recurrent dislocation, the patient can do abnormal movements of the joints. Then you can confirm by the cardiac, even if the patient have no symptoms of the heart, you can ask him, do you feel heart racing? Then the abdomen, the patients with Ehlers-Danlos, for example, they may have history of bleeding. So I try to help you by telling you about this bleeding, but actually you should ask about that yourself. So again, as we say all the time, the eye see what the brain know. So I totally understand your excuse because you don't know much about the disease, and I don't know much about the disease before preparing for PACES, and everyone, because it's not a common disease. But unfortunately, it's common in the PACES. For example, anyone going to Whipps Cross Hospital, there is a patient, and there is Ehlers-Danlos patient also in Manchester Hospital, and both of them they are working in the hospital. So the PACES, they have their diseases. Okay, the red colleagues, they like the retinitis pigmentosa, although it is rare. They like Ehlers-Danlos and pseudoxanthoma. One of our friends also gets pseudoxanthoma in Scotland, I think. So anyway, this disease appearing in the exam. So it's now it looks like a difficult case, but once you study and have it slide, you will say, inshallah, I will find that in the exam. It's better than having.
It was not difficult. The issue that, as you said, I was not familiar with this.
Exactly.
I could not remember. Yes.
Yeah, Dr. Ahmed, this means it's difficult. I mean, when I have a disease that I have, it's the same as porphyria. Is it a difficult case? Porphyria is not difficult, but the problem is not a common disease. So we're not facing every day in our life, so we can't remember the details of this disease. You got my point?
Of course. Yeah.
So you catch it very early, but the problem that, yes, I know it's Ehlers-Danlos. What should I do? I don't know. And everyone don't know if we didn't study. That's it, okay? So simply I will give you an idea about the disease, what to ask and what to examine. Then if you face this case, it will be super simple for you, okay? So let me show you now what we're going to do. I will just give you where's the paper? Just a second, because I wrote some comments here. Yes, you didn't examine the heart. You told the patient it's a collagen problem. The patients don't try to give the patient medical details that way. If you don't know how to say it, just say there is some substance in the body. It's called collagen, and this collagen is responsible for the integrity of the skins and the joints and this parts of the body. Okay, and the wall of your blood channels. Okay, so when there's a defect, okay, in this material, these problems start to arise. So you can't just explain as I told. Don't say because of the collagen, because it's not supposed for anyone to know what's the collagen. So say there is something called, or some substance, some material called collagen, and it is responsible for X. And when the presence of the defect in this material, there will be Y. This is the way to discuss or explain a certain the disease itself. Okay, so let me show you here about. I'll give you some idea about this type of diseases. The Marfan syndrome. Let me write it here for Marfan. It will be in my. I hope you watch my YouTube channel. Okay, because there is a tall stature lecture, and it is on Telegram, my Telegram group as well. There is the tall stature lecture, and there I'm discussing in details the Marfan syndrome. So here I will show you Ehlers-Danlos and the pseudoxanthoma, and in the lecture of the tall stature, you will find the Marfan. Okay, so here this patient's back. If this is a male, okay, I will give you an idea about that first. And this is the criteria, okay, for as per the international diagnostic criteria for Ehlers-Danlos. Okay, it's diagnosed clinically. So the first thing I want you to know that it is diagnosed clinically with specific criteria. What are these criteria? I don't want you to know the details, okay, but at least I want you to know that there is some criteria should be there. Okay, Ehlers-Danlos have 3 criteria, all of which must be present. So 3 criteria, A, B, and C. So generalized joint hypermobility, okay, so the joint hypermobility is on the top, then 2 or more of the ABC. So we need to find generalized joint hypermobility, then 2 of these 3. So we have 3 positive criteria. A is referred to 5 or more of the following. Okay, there is the skin hyperextensibility, but here remember in Ehlers-Danlos it is mild skin hyperextensibility. In Marfan also it is mild skin hyperextensibility, but it is severe, okay, and very obvious in the pseudoxanthoma. So remember that the criteria of the skin of Ehlers-Danlos, because you need to explain that to the examiner. You will tell him that there is a soft, okay, velvety skin, mild skin hyperextensibility. Just use your language in explaining that. There could be stria, and it would be stria or stretch marks without weight gain or loss. There could be abdominal hernias because of the weakness, because you lost the integrity of the abdominal wall as well. There could be atrophic scarring, and this is what I showed you. There's atrophic scarring. It looks like, as we said, fish mouth scar. So because of this weakness, sometimes you will find prolapse of pelvic organ, rectum, or uterus. So any prolapse because the integrity with the collagen is affected. There could be something like dental crowding and high palate. So when you look to the mouth of the patient, on the oral cavity, inside the oral cavity, you may see a high palate and dental crowding. Okay. So sometimes they have also a long thumb and the fingers. So archdactyly, okay, also maybe there, and it's that looks like what present in Marfan, but not in all patients. So never assume because the span and because the length of the fingers is not told that this is not Ehlers-Danlos. It's not positive there. This is not diagnostic criteria like in Marfan. So in Marfan's, having the positive wrist and thumb sign, this is it could be there for Marfan, but it shouldn't be there for Ehlers-Danlos. It's one of the possible criteria in Ehlers-Danlos. The other thing, other than the hyperextensibility, the skin, as you said in here, is positive family history in the first degree relative. Okay. Then the third thing is the pain, the presence of the pain, musculoskeletal pain in 2 or more extremities. And this pain shouldn't be since 1 week. It should be at least since 3 months. Okay, or chronic pain, at least 3 months or chronic pain. So if you just try to remember it, it is hyperextensibility or hypermobility. This is the top. Then 2 of these 3: the skin symptoms, the family history, and the muscle pain. So I think now it's clear. This slide will make it easy. Okay, for the skin, there could be mild skin hyperextensibility, presence of stria, atrophic scarring, and very thin fragile skin. For the heart, there can be mitral valve prolapse. This is the answer to the question, Dr. Amr. There could be mitral valve prolapse, and this could be the cause of palpitation. There could be mitral regurg, there could be aortic regurg, and there could be aortic root dilatation as well. Okay, so this is important. And to remember, aortic root dilatation also happened in Marfan. That's why the patient with Marfans, sometimes they are doing prophylactic surgery for them, and this prolongs their life. Before, all the patients with Marfans, they were dying very young, before 40, because of this. But now they are doing prophylactic surgery for that. So this is if you have a chest pain, shortness of breath, heart failure, awareness of heartbeat, it will be all related to these symptoms of the heart. What you can find in the mouth, or the oral cavity, I mean, high palate, temporomandibular joint dislocation. So the patient may come with severe pain and chewing, or with locked jaw because of the temporomandibular joint dislocation. You may find also crowded teeth. Will you find everything? No. As I told you, some criteria will be enough to diagnose the Ehlers-Danlos. The criteria will not be perfect there, but you need to know that what you're going to look for. So you need to look to the hand, the pulse, to listen to the heart, the chest. You need to check the mouth, the oral cavity, and check the skin. Then you need to check the abdomen. You need to check if there is abdominal pulsation. You need to ask about bleeding, and you need to offer to do a PR. Okay, you need to look for hernias. Let the patient stand and cough, especially for the Ireland candidate. Remember, you have a long time, so you need to do all these examinations. Okay, then the joints itself, it can be hyperextensibility, recurrent dislocation, joint pain, and kyphoscoliosis can be there. So now you know what is Ehlers-Danlos and what can be there. But I want you to know that there is, first look to this picture. The patient can do all that. Please, first of all, never pinch the skin yourself. Don't do that by yourself. Okay, never do that. Just ask the patient to do that himself. Tell him, can you pinch the skin? Does it look hyperextensive, or look, there is extensive elasticity? Then you see the patient can touch the floor with extended hand. When you look from the side to the patient standing, you will see that their knee is going back because of the laxity. The angle is above 190, more than 10 degrees to the back. Then the patient can touch his forearm with his hand. This is what I'm usually, when I see this picture, I'm trying to do it myself. So I'm sure some people are trying to do that immediately now. We will just discuss for the Ehlers-Danlos, okay, that the difference, the real difference between the Ehlers-Danlos and the pseudoxanthoma elasticum will be that the patient with pseudoxanthoma have excessive skin hyperextensibility, and they have a cardiac problem stroke problem and cardiac problem. So they have thrombotic risk factor. They may have MI, and they may have stroke, and hypertension, beside all what we said about the Ehlers-Danlos. So this is a very big difference. The patients will have premature coronary artery disease or premature strokes. This is with the pseudoxanthoma. But the patients with the Ehlers-Danlos, they are more with valvular heart disease problems, and they are more with problem of bleeding. So can the patient with pseudoxanthoma bleed? Yes. Patient with Marfan's, yes. But I mean, the pseudoxanthoma, you need to take care that they are at risk of the heart attack or stroke. So you need to consider early to watch that, to consider sometimes giving antiplatelets, to control the blood pressure, to do a regular echocardiography. Okay. So this is an important difference between both diseases. Okay. So as we said, the previous slide of Ehlers-Danlos is very important, and the coming slide is important as well, because this will show you the difference. This is the pseudoxanthoma elasticum patient. Take a look. Okay, there's something called anjoid streak. Okay, anjoid streak you can see in the eye. So when the doctor asks me to check the eye, yes, he may find some findings in the eyes. Okay, the eyes, as I told you, you can see some symptoms in the eye. I want you to add to the page of Ehlers-Danlos. Okay, there can be thin cornea. So go back to this slide. Right here, the eyes. There can be thin cornea. I know you can't find that yourself, but if you just for your information, what could be there? There can be retinal bleeding, retinal detachment, and blue sclera. So retinal hemorrhage and retinal detachment and blue sclera. Most of them will have will wear eyeglasses or lenses because they have myopia. Again, because of the collagen, there will be a lax lens. So retinal detachment and retinal hemorrhage. For the lens, there is myopia. For the sclera, there is possible blue sclera. Okay, possible blue sclera. So this is add this to this slide. Okay. Then I'll go back to the pseudoxanthoma. The eye, there is what's called angioid streak. Okay, the angioid streak. What is the angioid streak? It's cracks. It's cracks present in the plasma membrane. Okay, in the retina. Okay, I will show you. You see, it looks like there's cracks. Look here. Look at these black parts. Don't worry for the doctor who are worried about the fundus examination. Although this should be in your clinical course you will attend somewhere, but I will discuss with you in the eye day. There is a day when we discuss the eye. We will discuss the possible things in the fundus, so you'll be familiar with the findings you need to see in the fundus. So when you go to your clinical, you will be ready for most of the cases of the fundus. I like the fundus, and I would prefer if I have a fundoscopy case in the exam. Usually, I like the fundus cases because simply once you catch the finding, you'll get a good marks. So this is what's called angioid streak. Look, it looks like a break in the plasma membrane in the retina. Okay, and sometimes they have what's called macular degeneration. This is called the macula. We will discuss that later, but this is called the macula. There could be macular degeneration. So this is for the pseudoxanthoma. So blue sclera also can be there. Yes, blue sclera can be with the Ehlers-Danlos and can be with the pseudoxanthoma. For your information, and it can be with Marfan, and it can be also with osteogenesis imperfecta. So just for your information, if you want to know what the differential diagnosis of blue sclera, it can be with Ehlers-Danlos, with pseudoxanthoma, with Marfan's, and with the osteogenesis imperfecta. For patients with osteogenesis imperfecta, they will have that severe recurrent fractures since birth. So the patient may have more than 50 surgeries. Okay, when he's 20 years old. If you watch the movie which called Glass, this is a new movie, 2019. They had a patient who's a genius patient with osteogenesis imperfecta. They have fractured like glass. They call it a glass bone. Okay? So this is for the pseudoxanthoma eye symptoms. Then the skin. Here the skin is super lax. You see. And please don't mention the blood chicken skin. Don't mention that. This is only for your information. I've never mentioned it. Okay. So lax, wrinkled skin, neck, and axilla. So you see in the neck and the axilla, it's very obvious. But let the patient do the benching, not you. Okay. In the neck and the flexural areas. Okay. The mouth also can show this. It looks like the orange cover. Okay. There is a specific picture appearance of how the lips looks from inside. Then the heart, and here it is important: premature coronary artery disease, aortic regurg, mitral valve collapse, cardiomyopathy, and hypertension. Abdomen, the same as Ehlers-Danlos, hernias and GI bleeding. Joints, hyperextensible joints. Neurology, there could be CVA. How to treat this patient? What do you think, Dr. If the patient is Ehlers-Danlos, and now after that, not Ehlers-Danlos, let's say patient with pseudoxanthoma, what do you think is the most important patient treatment?
The most important, I think, is
pseudoxanthoma. After the rest I told you about.
That's coronary artery disease.
Exactly. It's protecting them or follow them. Have a close eye on them. So you need to advise this patient to stop smoking, to control his blood level, to check his heart regularly, right? To exercise. You agree with me, right?
Yeah, sure.
Is it a good idea to put this patient on prophylactic antiplatelet? They are at risk. So why not to put them on clopidogrel or aspirin because they are already at risk? Is it a good idea? What do you think?
No, I don't think so.
Why? Because the patient already at risk of bleeding.
Yes,
right?
yes, of course, yeah.
Because the patient is at risk of bleeding, of GI bleeding, okay? So they have a GI bleeding, retinal bleeding, cardiovascular bleeding, cerebral bleeding. So it is not simple to take this decision unless the patient already have event. Usually they advise this patient to decrease the calcium intake in their diet. I don't know what the mechanism, but actually this is one of the measures they are done with the pseudoxanthoma. Okay, they decrease the calcium. I read about that. I'm not sure. I don't want to tell you something I'm not sure about, but they advise decreasing the calcium diet, stopping smoking. But this is very important and will impress the examiner. Tell him that we're going to advise him to stop smoking. You didn't ask about smoking. Advise the patient to check his blood fats or blood lipids, okay, and check regularly with the cardiologist. For the GI bleeding, okay, the patient should take care of taking himself NSAIDs or aspirin. Okay, for the eye, you need regular ophthalmology consultation, okay, and close blood pressure monitoring. Okay, so this is for the pseudoxanthoma. The pseudoxanthoma is less. Sometimes it's autosomal. The inheritance is autosomal recessive in 80%. Okay, so in 80% it is autosomal recessive. So the family history will not be strong like in Ehlers-Danlos. Okay, and that's it. So you can study both cases together. The only obvious difference is the skin problem in the pseudoxanthoma, the skin, and the premature coronary problem. Okay, but most of the things are the same. For your information, the differential diagnosis of hyperextensible joint is pseudoxanthoma, Ehlers-Danlos, osteogenesis. But remember that some diseases, like some genetic problems, like Down syndrome, like Turner, like Fragile X, like Noonan, they all have hyperextensible joints. Okay, so remember that the people with genetic disease, they have hyperextensible joints as well. Okay, patient with blue sclera, as I said, Marfan syndrome, hypophosphatemia, they have it. They have also blue sclera. Patient with angioid streak, the same. So all sharing the same. So just remember the four of Ehlers-Danlos, pseudoxanthoma, Marfan, and osteogenesis imperfecta in these differential diagnoses. Okay, so now give me the okay that now you are not worried about a case of Ehlers-Danlos or case of pseudoxanthoma. Give me the okay of the chat box. Feel that?
Just one question, Dr.
Yes, please.
Why kyphoscoliosis with Ehlers-Danlos?
I don't know. This is why it happened. Okay, maybe related also to the hyperextensibility of the joints itself. Okay, the mechanism I don't know, but it is part of the case. So you need to look to the patient back. So it could be the hyperlaxity of the joints itself, right? So I don't know the mechanism exactly or the pathophysiology of the presence of, but it is there. You need to look to the patient back in the three cases, even in the Marfan, even in the Ehlers-Danlos, and the pseudoxanthoma. Okay.
Okay, thank you very much.
Okay, thank you, doctor. So now remember these slides you have for these two diseases. So it's not a magic now. When you see a patient, a candidate telling you that this was my cases, you will not feel it is a different thing. You'll say, hey, you are lucky, and this is my objective. Okay. So let's move to the next case, which is. I want you to notice that it's very simple for me to say I don't know. That's what I want you to do in the exam as well. So if you don't know, just say, I'm not sure. I will check and come back. Don't try to just give an answer to give an answer. Okay, this is for everyone. So please, whenever you're not sure about something, it's not the end of the world, because this is quite a general exam. You shouldn't know everything about everything. So please, whenever you don't have an answer, just say, I'm going to check with my seniors and come back to you. I will check and read about that and come back to you. This is accepted. They never understand how we just create answers. Okay, so let's go now for Dr. Muhammad. Dr. Muhammad Muslim Islam.
Yes, Assalamu
Alaikum. Just a second. Yes. So let me just show you the piece. Okay, Dr. Muhammad. Again, this is a patient with hand pain. Very common, a lot of topics may be related to the hand pain. That's why I'm telling you, it is one algorithm for 1 million case. So this is Mr. Daniel Wingali, and he is, I don't know what is his age, but anyway, let's assume that he's 50 years old. So Mr. Daniel present with 6-month history of pain and swelling in his fingers, and he is concerning as he is an artist and worried about his painting. Hand. This is his job, painting, and he's worried about that. Okay.
His age?
His age is actually it's 35 in the page. In the paper, it's 35.
35.
35. Yes. You have 1 minute.
Okay, sir. Hello?
Yes, sir.
Yes, sir.
You want to
Can
start?
I start, sir?
Yes,
Okay.
Start the timer.
Hello, nice to meet you. I am Dr. Islam, one of the doctors in the clinic.
Dr. Muhammad, wait a second. I'm just starting the timer. Just a second. So this is really okay. Start. Okay, we can start.
Hello, nice to meet you. I am Dr. Islam, one of the doctors in the clinic. You are Mr. Daniel, 35 years old.
Yes,
Am I right?
I'm 35 years old. Yes.
I have been asked to examine you and talk to you. It's okay for you?
I'm good, doctor.
Okay. Mr. Daniel, you would be that you have a 6-month history of pain and joints and swelling in your fingers. Could you tell me about more?
Yes, doctor. In the last 6 months, I'm suffering of hand pain. I ignored that in the beginning, but lately it started to hurt a lot, and I can't work anymore because of that.
Okay. Okay. Mr. Daniel, is it joint pain? It's a joint pain or electrical pain or pain or it's a cause
pain in the joints, doctor. I feel the joints of my hands already hurt.
Joint pain.
Yeah.
Do you have any stiffness or laxity?
There is some stiffness, doctor. Yes.
Okay, stiffness. Does it increase by rest?
By rest? Increase by rest?
Does it increase by rest or decrease by rest?
I would say that.
Okay. It is a you say you have a stiffness. It is a when it's a morning or evening or night or whole day.
Actually, for the stiffness, doctor, it is in the beginning of the day only.
Okay. It is more than 1 hour or less than 1 hour.
I'm not sure, doctor, but it takes only some part of the morning. Then after a while, when I prepare my breakfast, then it will be okay.
Okay. And does it take in changing color when you in cold water?
No, doctor.
Okay. And do you have any skin rash or skin tightening?
Yes, doctor. I'm known to have a problem in my skin since 2 years, for which I'm taking medication.
Oh, can you show me your skin rash?
Yes, doctor. Here, doctor.
Okay. Do you have any rash in other part of your body?
Yes, doctor. I have in my knee also and behind my ears.
Okay. And do you have any deformity of your hand?
Deformity in my hand? This is my hand, doctor.
Okay. Any other part?
Yes, both my hands, doctor.
Okay. And yeah. And you have a pain. Can you put me the one scale? It's 0 where is minimum and 10 is maximum.
Yeah, four.
Okay. And is pain is related to any part of your body or on?
This pain mainly in these joints, doctor. Mainly.
Okay.
Yeah.
But did you notice anything worse in your joint pain, like movement, like any medicine or drugs?
Nothing specific, doctor.
Okay. And do you feel any rash in increase in facial rash in your face?
I told you the rash is the same since 2 years. I'm taking a topical medication for that, and the doctor also added for me some medicines, injection called methotrexate lately, and that's it. I think sometimes improving, sometimes getting worse.
Okay. Do you have noticed any globus passes in your urine?
No, doctor, not so.
Any shortness of breath or increasing of heart?
Shortness of breath and racing heart. Sometimes there is some shortness of breath. 2 minutes.
Okay. Okay. I want to examine you. I examine your skin rash. It seems to rash and it's due to your distribution. Okay. I want to examine your
the rash. The rash, as you said. What else you want to examine?
I look for joint swelling, deformity, scar, and movement of the joint.
Okay.
Like a prayer sign, and hairline, and eye for any redness or weakness. And I also want to examine the chest for lung effects, and also auscultate the heart for any murmur.
Okay, no need, doctor.
Okay, okay, and do you smoke?
Yes, doctor. I'm a heavy smoker.
Okay, smoking is a injurious to your health. So I want to if you to go to have you want to squatting it?
No, doctor. But I'm thinking about that. Thank you for advising.
Okay, thanks. And do you drink?
Alcohol, yes, doctor. I'm a heavy drinker.
Okay, okay. So you heavy drinking also related to the cause why you should cut down it. Do you drive?
Yes, I'm driving, doctor.
Okay. Do you have a non-medical illness
Time finished, doctor. Time finished.
Okay.
Okay, doctor. What is the concern of the patient?
Yes. Hello.
Yes, doctor. What is the concern of your patient?
And your patient concerns is his painter.
Is what?
Painting. And
who told you that this is his concern?
No.
I mean, why it could be something else. Maybe he's here today to take sick leave, right?
Yes.
So you didn't ask the patient about his concern.
Yes.
Okay. So this is a big problem. So the impact you're asking about, the patient told you about the impact, but you didn't even ask about the concern. This is very important, right?
Yes.
Okay, so the first question the examiner will ask you if you didn't ask about the concern will be, what's the patient concern? And you will be shocked at that time because you didn't ask and you don't know why the patient's here today. The patient already diagnosed with psoriasis before and you don't know why he's here today. And maybe he's here only because he wants to change his insights. Maybe he wants to ask for sick leave. Maybe anything. Okay, so the asking about concern is very important. Okay, so it's scoring time. What did the scores? Doctor, write a score in the chat box. Then I will proceed. So thank you, Dr. Muhammad. Good trial. Okay, you just need to learn how to, you need to organize the time, right? You need to use the time. You wasted a lot of time. You reached the diagnosis in the first 2 minutes, right?
Yes.
So if you know the diagnosis in the 2 minutes, you should get a full mark in the case.
Yes.
Right. So it's about how to do it. This is when in this case I call it. It's not about your ability to play. It's about practicing, and it's about the rules of the game. Right. So here it's like someone has the skill of playing football, but he doesn't know the rules of the game. So you need to learn the rule of the game of utilizing the time and present yourself in station 5. So simply what you did here. Okay. Most of the candidates give you between 14 and 18. Okay. The first of all, you need to go through the algorithm. This is pain, right? It's pain. You need to start by Socrates, right? So simply you will go to, let me go back to the algorithm and show you simply how to use the algorithm. That's why I want everyone to practice the algorithm. Okay, keep practicing the algorithm, you will not be lost. So simply what's going on, I need the algorithm to reach the diagnosis. Once I reach the diagnosis, I will deal with the disease I find myself. Okay, so simply this patient came with the hand pain. So can you tell me about this pain, the severity, the size of the pain is in the hand, the onset, is it acute or gradual? It's gradual, increasing, decreasing, it was increasing, duration since 6 months, okay, severity 4/10. Okay, did you notice any, is it in both sides? Yes or no, whatever, it will tell you. Okay, for the symmetry. Any swelling? Yes, there is a swelling. Any stiffness? Yes, there is a stiffness. How many joints affected? This is for the number. Okay, then any deformities? Okay, yes or no. Then rash. Do you have any rash? Yes, show me the rash. So at this stage, you will see the rash. You will know that this could be psoriasis, could be lichen, could be eczema. Based on what will be the rash you will see in this stage. Okay, then there is a stiffness. So I will ask about this stiffness. Is it, don't ask, as I told you, not sharply 1 hour or more. Just tell him, is it part of the morning? Yes. Is it more than 1 or 2 hours? Okay, this stiffness, yes. It is only less than 1 hour. I would say less than 1 hour, doctor, for example. Okay, and again, the question about, we said there is 2 questions that can help us to differentiate mechanical pain from the inflammatory pain. The first thing is the pain improve a little bit with the activity. Usually you don't think that the patient will be asymptomatic with the activity, but I mean the patient sometimes when he does some activity, the symptoms is a little bit less. When he starts to sit and rest, the pain starts to appear more severe. Okay, so the question should be, did you notice? Okay, that this pain improve, okay, with or a little bit improve with the activity. This is how I want you to ask this question, not as it's written here, not does it increase by rest. You want me to say, does it change with the activity, improve with the activity? So this is the first question, the stiffness and its duration and the improvement with the activity. So we are on the right side of the algorithm. Otherwise, we will go to the left side of the algorithm. Okay, so on the right side of the algorithm, it is inflammatory and the duration is less than 1 hour. So we will ask about the back pain, and there could be back pain. There's psoriasis. There's a very important question you didn't ask in psoriasis, doctor. Do you know what's this question? Did you ask about nerve change? Dr. Nusr Islam.
Yeah.
Nerve change is super important to ask about.
Yes.
You agree with me?
Yes.
So you asked about the gout, but you didn't ask about the nail change. So the skin rash, the nail change are very important. And you need to ask about all the pizza. As we said, once we start, let's continue the pizza. Okay, and once we started, let's continue. I will give an advice. Whenever it is hand pain, okay, you need to ask, this is hand pain. We started by, don't forget the question of the nature of the pain. Tell me, what is the pain? Is it cold? Is it pain at the tip of the finger with color change? On the cold weather, is it electrical pain with numbness? Is it joint pain? We asked this question and we went to this side. But I will give the advice, whenever it is hand pain, please go and ask both pizza. Ask about both of them, please. Don't assume that based on the duration of the stiffness, it is enough and it would never be this pizza. And even if you found that both these pizza are negative, go to the green pizza. So when you ask me why I'm going to do that, it's like you keep searching and searching for what's hidden in the case. So if I found that nothing of the seronegative, I will not say, hey, it shouldn't be a positive because the stiffness is less than 1 hour. So you still need to exclude. You can't go to the case of hand pain in cases and don't exclude rheumatoid arthritis and don't exclude the systemic lupus. So this is advice now I'm asking for you as a pro. Now you are pro, so you're under professional. So you know the difference between what I said yesterday and today. I'm adding. When you have time, go ahead and ask for both pizza. Okay. So especially if you have time. Okay. Because sometimes there may be something hidden there. If you didn't get the answer in the blue pizza, please go to the red pizza. And if you didn't get the answer, go to the green one. Okay. Here, this case, doctor was psoriasis. Okay.
Yes.
This case was psoriasis, and the patient has a history of psoriasis. And okay, let me just go there. If you look to the patient nails, there is bitting nails. You see the bitting nails. Okay. So the nails in psoriasis, there is bitting leukonychia. Okay. And there could be splinter hemorrhages. There could be some hemorrhages, like dots of hemorrhage, and onycholysis. Onycholysis. So you need to know these things. You need to know, and you need to comment on that. Okay, you should comment on that. You should look to the nail of the patient and say, when examining the nail, there is a nail, bitting nail, splinter hemorrhage, and onycholysis, based on what you will find. Remember, only mention what you can see. Don't mention only what you know should be there. Okay. Then we will go with the psoriasis. The very important issue in psoriasis is there's no slide for psoriasis here. There will be one. Okay, but I mean, I want you to write that exacerbating factor is very important. You need to give a patient advice regarding stress, smoking, alcohol, and medications. You know, psoriasis become worse with beta blockers and NSAIDs mainly. There is a big list of medication that worsening the psoriasis, including interferon, including hydroxychloroquine, and beta blocker and NSAIDs. Okay, Doctor, I'll close your mic because there is some background noise. Thank you, Dr. Islam or Mr. Islam. Okay, so for the psoriasis, remember the exacerbating factor: alcohol, cigarettes, medications, and trauma. Okay, for the treatment, we give Buva, the Suraline ultraviolet. Sometimes immunosuppressions like methotrexate. Sometimes, what do you think about steroid in psoriasis? Is it a good option? Tell me in the chat box. Is it a good option to use steroid? No. Why? Because this came usually it comes in the exam. They will tell you that I used, for example, steroid for my chest, and I noticed that my skin symptoms improved or my joint symptoms improved. So I agree with you, yes, because there is steroid withdrawal exacerbation. These patients, once they stop the steroid, there will be a rebound and exacerbation. So when the patient asks you about that, and this is common in the patient concern, he will tell you that when I tried steroids for my chest problem, I noted that all my joints and skin symptoms improved. But actually, once he stopped the steroid, there is a very severe rebound. So it's not part of the treatment. The topical steroid is okay. An examination of the patient of the psoriasis. Let me do this case myself. So hello, sir. Can you tell me about this joint pain, this hand pain? Is it pain on the tip of the fingers in the cold weather? Is it electrical pain and shakes? Is it a joint pain? Joint pain. Okay. Can you tell me more about the site of this pain? What about, did it start suddenly or start gradual? Since how long? Did you notice that it's increasing or decreasing? Okay. Okay. Did you notice that the activity improved the pain a little bit? Do you have any stiffness? Is it in both sides? Any swelling? Did you notice any deformity? There is any rash? Yes, there is rash. Can I see this rash? Oh, yes, I see. Okay. Can you tell me since how long you have this rash? Are you on treatment for that? Did you notice something worsening that? Okay. Can I see your nails, please? Because now I'm sure it is psoriasis. No need to go anywhere else. For me, I will do that. Okay. Show me the nails. Okay. I will look at the nails. Okay. There is a nail pitching. There's an edema. Do you have any shortness of breath? Did you start any new medication? Do you smoke? Do you drink alcohol? This is station 5. Do you smoke? Do you drink alcohol? And do you have hypertension? Do you take any medication? Can I look to your medication list? I will look to the medication list. Can I examine your chest? I'll put the stethoscope to check that. Do you have any of this rash in the private area? I'm sorry for this question. Okay. Okay. So then, okay, what I see now, do you have any back pain? Okay. Do you have any sores in your area in your body? Do you have any problems in you? Do you have any flank pain or lung pain? Okay. Do you have any change in the color of the urine? Okay. Do you have any history of passing stones? Okay. Do you have any blood coming with your back passage? Okay. So thank you, sir. So my what's your job? I'm painter. How much this affecting your job? Affecting it severely. Okay, for blah blah blah. Okay, I'm sorry for that. Do you smoke? Do you drink alcohol? Do you know that smoking and drinking alcohol can worsen your condition? I would offer you some help to help you quitting through our smoking cessation and alcohol control clinic in our hospital. Okay, so if you look to the medication list and you found that he's in beta blocker, newly in beta blocker, then we need to consider, okay, this medication can worsen your condition, but I can't change it without going back to the heart doctor, okay, and check if he give you more safe medication, or if he still want this medicine to control your blood pressure. Okay, so any other, what's your concern? My concern is blah blah blah. Oh, okay, this joint pain is related to the condition that you're suffering from in your skin. Sometimes this joint pain starts before the skin, sometimes during the skin lesion, sometimes after the appearance of skin lesion. For now, we will give you some medication. We will include the joints doctor and we will include the skin doctor and the physical therapy in order to try to help you to deal with this condition. Okay, do you need to ask me any other question? Okay, so thank you, and that's it. Okay, so nothing more. You will describe for him also for your medication. We can give a topical treatment. Some medication can be prescribed and can help your skin. But here he's not for the skin, he's for the joints. So the treatment for the joints can be, okay, when the examiner asks you, it can be starting by simple analgesics. Okay, for the joints pain. Okay, then we can reach up to biologics. So we can give immunosuppressant and biologic for the pain. Something you need to add here for the psoriasis also. You can ask if you notice that this skin lesion increase in the site of trauma. Okay, so you will see the slide for the psoriasis. There's no slide here because this will be discussed in the skin day. In the day of dermatology, there will be a slide for the psoriasis. Okay. So here there is what's called a Kapner phenomena. That Kapner phenomena, that the symptoms or the lesion appear at the site of trauma. Do you know what are the diseases that share the criteria of Kapner phenomena? Write in the chat box, please. Write in the chat box what are conditions you know that will happen at the site of trauma. Yeah, vitiligo. Okay, scabies, vitiligo, scabies, no, viral wart, lichen, yeah. So vitiligo, lichen planus, psoriasis, viral warts, yeah, and sarcoids. Exactly, sarcoids. Okay. Then causes of nail bitting, you will see it in lichen planus. And sometimes fungal infections, onychomycosis or paranoia. Okay, paranoia and lichen planus and psoriasis, they all can cause. There is a very severe condition can happen with psoriasis, and it's life-threatening. Do you know its name? What's the name of the condition that can kill the patient with psoriasis? Exactly, erythroderma. Erythroderma. Erythroderma is life-threatening condition of the psoriasis. Okay, so here, I want you to know, because here I'm not talking about the dermatology, I'm talking mainly about the arthropathy, psoriatic arthropathy. So there's different forms of psoriatic arthropathy. That's why you should ask about the back pain. The first one is distal. It is involvement of the distal interphalangeal joint. You know, you see this one from the rheumatoid arthritis. Patient with rheumatoid arthritis, okay, will have